that they're going to reduce the budget allocation of the family planning contraceptives by 10 million. And we moved within the coalition, and we actually engaged the policymakers, Minister of Health, Minister of Finance, as well as the parliamentarians, and also followed up in our approach by each of us in the coalition coming out with press releases for each of the 5 days from the time that the budget was passed in Parliament. And the result was, instead of the reduction, they actually Parliament increased the budget by 9%. So when we look at that, that was a very big achievement for us. And then in terms of our challenges, maybe before I go to the challenges, the other part was that maybe the budget that I'm saying that was increased by 125%, government also made sure that the full budget was actually spent. So they dispersed the allocation and the budget was fully spent. In terms of our challenges, just like my colleague has said, the availability of data becomes difficult because it's not available online. And then when we go to the ministry, we create relationships. But sometimes, with the changes of the government, people are moved from one department to the other. So you have to start the process over again. Thank you.
Thank you so much, Wezi. Nazir, would you like to talk about the context and objectives within TCDC's work on government accountability?
Thank you, B. The work of TCDC in Tanzania, we work on breaking the barriers for data transparency. So our objective, we had two objectives. We focus on increasing FP commodities on allocation to meet the greater need for the funding need. And this is because the allocation was less than the need for the country. So that's why we see this as a gap, and we focus on it. And another thing is we focus on ensuring that the FP commodities allocation are fully disbursed and spent. This was also another issue that we noted. That's why our objective focus on these two areas. So since we started implementing this intervention, few successes that have been achieved. And one of the things is the contraceptive budget increased from 10 billion to 14 billion in 2017 to 2018. And before that, before even when we start this initiative, the budget allocation was 4 billion. So when we were on the ground and implementing our advocacy, we moved the budget from 4 to 10 billion and then to 14 billion. And however, but it remained constant for the entire period. And this is one of the things that we are focusing on, how we can improve on budget allocation. And another thing is for 2019-2020, through our advocacy initiative, it managed the government to procure 90% of all contraceptives in the country. And we have remained with no stockout for several years. And all of this is evidence that we have shared from the Family Planning Budget Scorecard, which has also influenced, it really influenced the FP 2030 commitment. So in FP 2030 commitment in Tanzania, we have an accountability commitment, which requires a government to increase 10% of annually allocation. So it means if this year the allocation is 10 billion, so the next year there should be a 10% additional of the allocation. So, and this is how we work to ensure that the 14 billion does not remain constant. So in terms of challenges, I think we have some similarities with other colleagues that what they've mentioned. One of the things is the budget collection process has been very difficult for us. And this is because the Tanzanian budget, the family planning budget is within the preventive services budget. So it's a lump sum. So when you do tracking on the budget books, you only find the lump sum of all commodities, drugs and medicine in preventive services. So in order to get that information, that you have to crack it down to ensure you have to reach now specific directorate, specific department, and with the request so that you can get this information. So this has been a challenge for us during implementing this initiative. So, and another thing is, another challenge we have experienced is for Tanzania, we have experienced two governments in a period of 6 years. We had the fifth government where our president passed away, and then we had the sixth government. So, and in each regime that takes over, there is a reshuffle. So, and this is one of the challenges, that some of the technocrats who have been reshuffled from department to department. So through this process, like it leads us now to restart again our advocacy process. And the advocacy is a process. So we had to redo again, especially to introduce our FP Smart, because the approach in this intervention, we're using the FP budget scorecard as a supportive fact sheet, and then also the approach, we apply the FP Smart approach. Thank you. I think I'll end here for now.
Thank you so much, Nazir. I appreciate it. Last but not least, Charity. You want to talk about Samasha's work along the Government Accountability Project?
Thank you, B. So for Samasha in Uganda, the objectives that we are focusing on in this project, in tracking budgets for family planning, the first objective is to increase allocations to family planning programs. Family planning programs include all the service delivery, demand creation, policy and enabling environment, stewardship, management and accountability, and family planning commodities, which we basically know as contraceptives. So the first objective is to increase the allocation overall for those services and commodities. The second objective that we are focusing on is to have a clear budget line for family planning programs, because what happens is family planning programs fall under the Reproductive and Infant Health Division, which also takes on maternal and child health. So when the budget's aggregated, it's very difficult for us to track what specifically goes to family planning. The third objective is to have 50% of the budget line within that division allocated to the procurement of family planning commodities. So there's a split between the maternal and child health commodities and family planning commodities. However, over the past 3 years, we've seen that very little, less than, I think, 1% was going to, 2% was going to misoprostol, which is also a maternal child health commodity, and the rest was going to the procurement of safe delivery kits. Family planning commodities were being procured using another allocation from the GFF. So in the work that we've been doing, the interventions that we've been doing to achieve this work have involved a very strong element of partnership. So we partner with other budget advocates in Uganda because it's easier when you go together, and it also avoids duplication of efforts. We've also done very well with partnering with the Ministry of Health, and the Director of Clinical Services, Curative Services is here. He's been very supportive of the work that we do, and they've been giving us the data that we need, at least for allocations and disbursements, as well as the Ministry of Finance, Planning and Economic Development. Then we've also supported, we've built capacity of various CSOs within family planning so that there's more of us doing this work. And the other way that we've been able to achieve that, what we do, is to ensure that we find out the strengths and weaknesses that we all have. So if there's an organization that's very good at putting the data out there, if they're very good with the displays and engaging, we collaborate with them. We provide the evidence through scorecards, the FP budget scorecard that we're talking about here. And this evidence has been presented before the Parliamentary Health Committee, and we've been able to get to them, to speak to them, to advocate for increased allocations to family planning. So among the successes that we have achieved over the past 3 years, the first one is that in the FP 2030 commitments, the government of Uganda committed to allocating 50% of the reproductive health budget for the procurement of family planning commodities. So we are only a year in, barely a year into the commitments, but we see that this is a big step because over the past 3 years, that commitment wasn't there. The other success that we achieved is that over the past 3 years, the overall budget for family planning programs, which is the services and the commodities, increased from financial year 2018 to 19 to the financial year 2019/20, it doubled. The only issue is that the component that goes to family planning commodities was small, but that's still a win for us. The third success that we've witnessed is the fact that more and more people, policymakers, are actually using our evidence. They're using evidence that we produce to make decisions. So we work hand in hand with them. We provide the evidence as far as the allocations and disbursements and what we find. And then other partners provide evidence based on stockouts of commodities. And then all of this goes into the annual quantification processes, which the Ministry of Health does. The challenges that we face are similar to the other countries. Our biggest challenge is actually accessing expenditure data. It's very easy to access allocation data because that's publicly available on the budget website of the Ministry of Finance. But as you go down the line and look for disbursements data is there, but sometimes it's not timely. But when it gets to expenditures, that's very difficult. So that's a pain point for us. And then the other challenge is that, so this commitment that was made by the government of Uganda in the FP 2030 commitments has not been, this is what, 10, 11 months into the commitments, it hasn't been realized. However, with engagements between the Ministry of Health, other budget advocates, and the National Medical Stores, which is an MDA that is in charge of procurement and distribution of family planning commodities, we've been able to come to a sort of compromise under the leadership and guidance of the Director of Curative Services. He was able to guide the ministry to ensure that at least we start with an allocation of 25% of the reproductive health items going to the procurement of FP commodities. And this was also moved through the Permanent Secretary, Ministry of Health, and they instructed the National Medical Stores to ensure that this happens in the next year's financial budget. So the compromise was that we cannot have the 50% allocation immediately, but with time, over a period of maybe 2 or 3 years, we'll be able to get there, and this is a first step. Thank you.
Thanks so much, Charity. I appreciate that. So we've heard from our colleagues here about their application of the Government Accountability Project, the scorecard, which is this key piece of being able to track effectively how governments meet their financial commitments to family planning. In other words, looking at how much government says they're going to spend, or how much government they say they're going to commit to family planning, how much they eventually disburse for family planning, and then how much of what they disbursed gets spent for family planning. And particularly looking at family planning commodities as a key piece of this work. So we've heard from our colleagues around this accountability part, but one key message that's coming out from this is using that accountability mechanism as an advocacy tool, flipping it around to be able to get additional funding or resources for family planning, and what that means in the future for ensuring that countries are able to invest effectively in family planning services. So what I'm sure people want to know is, what are the next steps? We're still in the throes of the COVID pandemic. Some of your countries have been able to increase their commitments to family planning spending, but that's not the end of the story, right? There's still more to do. Can you tell us a little bit about what your next steps are going forward to increase this accountability work, increase advocacy for spending on family planning? I'm going to start with you, Charity, since you were the last one to go. Please go ahead.
Thank you, B. I'm going to just continue where I left off. So Our next steps, Samasha will continue to track budgets for family planning with specific emphasis on the allocation for family planning commodities. We're going to follow up with the Ministry of Health to ensure that we achieve the 50% in the FP 2030 commitments. And then the other thing that we're going to keep doing is collaborating, partnering with various other partners, advocates, and also policymakers, the Ministry of Health, members of parliament, and anyone else that is willing to support us. Then the third thing that we're going to do is also work with organizations like Transparency International and HBN Africa Health Budget Network in Nigeria, because even these cross-border partners are very supportive in showing us or learning, sharing experiences, and also increasing our capacity and ability to improve budget transparency in Uganda and support family planning accountability. Thank you.
Thank you very much, Charity. Over to you, Nazir.
Thank you, B. For Tanzania, right now, the environment is good. We have a political support, and the policy environment as well is good, because in last year, 2021, the government released the RMNCH, or we refer it as One Plan 3 document. And this document, among the 5 priorities, family planning is one of the key. So given that the policy environment and the political support right now with our president, she's very supportive on maternal health. She has a campaign on reduction of maternal mortality, and also champion on issues of teenage pregnancy. So we are going to use this effectively, tracking down family planning budget data to ensure the government meets its FP 2030 commitment. That's one. The second thing that we are thinking and we have now initiated is we are reaching the Ministry of Health to ensure that they are releasing a guideline on transparency for data, especially there should be the allocation data, the expenditure data, they should be published online regularly, because we have a challenge on accessing data. So we think working on enabling the policy environment, having such a guideline will be very helpful, not to us, but to all members who are in the country who are working on the area of family planning and maternal health in general. So, and also I think I need to acknowledge the coalition members who are in this room, because we have really been working together to achieve this, and even this will be moving together. As you know, if you want to reach far, you have to work as a team. But if you want to move quickly, then you can work alone and you don't end anywhere. So this is what I have to acknowledge some key members who are here. Thank you.
Thank you. Wezi, can you talk a little bit about Manasseh's work going forward? Thank you.
Thank you very much. Just like my colleagues had actually previously alluded to, we will still continue in terms of the budget tracking, because the win that had already said where the government had announced that they will reduce the budget, we had advocated as civil society and they had increased it, but because of some delays in the processes in the government, we found that the allocation was never spent in that year. So the following year, we continue the work, and then in the following year, we actually advocated as well as coalition. So what the government did was to make sure that what was lost in the previous year, they'd increased it to the allocation, which was in the previous budget. So that's one, the 2022-2023.
Health Advocacy and Policy Advisor. Thank you to all the panelists for really interesting sharing of information about how it is to track budget advocacy in your different contexts. You've spoken about the challenges of engaging with Ministry of Health and Ministry of Finance to get transparent information in a timely manner. What sort of approaches would help systematize the way that the Ministries of Health and the Ministry of Finance report to CSOs? And do you have any ideas of how to establish and implement those approaches so that when governments do change, the system continues and people can still continue to get that kind of information? Thank you.
Should I take a few questions? And
Yes,
then-
please. Let's take 2 questions at a time.
Two questions, sir?
I think she was taking a walk in my mind. So that was my question as well, but this was not directly directed to the panelists, but to all of us, considering that we are a different set of partners in here. I was thinking if there are any best practices or approaches that we can use to collect data from the Ministry of Health, because this came out as a challenge from almost all the countries represented. So if there are best approaches, if we could share in this room. Thank you.
Maybe we'll take 2 more. And I'm always terrible at this. Maybe can we start on this side and then I'll come to this side? Okay, thank you. Thank you.
Hello, thank you. I'm curious, what is the rubric for your scorecards? So what are the things that you're looking for, and like what are the line items for those scores? Thank you.
Anyone from this side? Okay, Tib, one more.
Yeah, thank you so much. Mine is just a compliment in line with that question. We work as a team, just like Charity said. We are a collaborative team from Uganda. And one of the best practices we are bringing on the table, we are bringing the voices of non-traditional advocates, like the religious and cultural leaders. And in that collaborative effort, they are trusted. And that means that the ministry will be able to trust that the information we get, we are not going to misuse it, because sometimes they are worried about us advocates publishing, and then so we have a new initiative. We are working together and we are bringing in the voices of the religious and cultural leaders, and is supported by Reproductive Health Supplies and Coalition. Thank you.
Thank you. So, yes, let's if I may take a quick pause to let our panelists answer the question, and then we'll get back to the next round of questions. So I think the question we have here is around that big issue of data access, availability, and accessibility. So and institutionalizing, ensuring that it doesn't change with government, it doesn't change with individuals, that it's consistent and reliable. I think it's, if I understand it clearly, and equally important, the scorecards. What are the dimensions within the scorecards, and how have they applied and useful in your work? Who would like to be the first to take this question on? Charity, over to you.
Thank you.
Sorry, Chair. Your mic is working. Sorry about that.
Okay. Thank you, B. I chose to answer first before I forget. Lest I forget. It's a trick. So I'll answer the question on the elements of the scorecard. So the scorecard has various indicators. One of the indicators is on adequacy. So that's adequacy of the budget. So when we use a common framework to track budgets, we separate the family planning programs, which I mentioned earlier, were service delivery, demand creation, any monies that go to those aspects: demand creation, service delivery, policy and enabling environment, financing, and leadership. And then the family planning commodities are tracked separately. So adequacy means how much of this, how much of the total health budget has been allocated to family planning as a whole, and how much has gone to family planning programs, and how much goes to commodities. The other indicator that we have in the budget scorecard is priority. So for priority, we look at we look at the total population of the country, then we look at the women, and then women of reproductive age, and that's ages 15 to 49. So reproductive age to see how much actually goes to them, how they are prioritizing the budget. Then we also have timeliness. So we track this based on especially disbursement data, because that's the one, at least for Uganda, it's quarterly. Other countries might be different. So we use that indicator as well. Then we also have a separate part of the scorecard, which deals with transparency. So we have different color codes, just like the traffic lights or robots for some countries. So you have the green, the orange or amber, and the red. So the green would imply. Sorry. So when you have green, that implies that you're able to access the data publicly. So on a website, you don't need to ask anyone to access the data. That's transparency. So when it's amber, that means you can access the data through maybe a partner, or you can access it through the Ministry of Health, but you have to request for it specifically. It's not available publicly. Then the red means there's no access to that data. So that's normally with expenditure data. Over the years, that has been the case. Then we also have an element of disaggregation. So we measure how disaggregated the data is. So for countries like Uganda, where you have the allocation being between family planning commodities and maternal child health commodities, if you can access the data showing you specifically where it goes, then that's a very good level of disaggregation. If it's all lumped up and you're doing a lot of maybe guesswork or estimation, then that shows that it's not disaggregated. I hope that answers your question. Thank you.
And if I may beg your pardon here, we actually have samples and QR codes that lead you to see the actual scorecards. We didn't want to put them up because they're pretty, the data in them is heavy, and we didn't want to put that as a way to distract from that. So my colleague, Susan, thank you very much. My colleague Susan has the QR codes that you can scan and get to look at the sample of the scorecards, and you can see what dimensions and indicators are within those scorecards. So thank you. And if you need one, we can pass this around.
Do any other panelists want to answer the question?
The rest of the question to anyone else who wants to pick up? Nazir, please.
Thank you, Charity, for responding on the scorecard item, line item. You exhausted, and I think I'll respond to two questions. One question on the best approach, and the other one on how to sustain access data online. So I think these have not yet been responded, so I think I'll do this. For the best approach, I think in each country, the best way you can work on a coalition. Like for Tanzania, working on budget accountability, it doesn't mean only TCDC works on it. We also work together with the members of Tanzania Coalition of Demographic Awareness and Action. So TCDC is also a member on it. So in this coalition, we have the common goal and also the objectives. We have our own objectives. So we work together to reach specific decision makers on specific issues. So, and for us, both data, allocation data and spending data, they are not available online. But at least you can access sometimes the allocation data. But with this coalition, it has been very helpful because some information are attained upon request. So, and also we have a joint voice. We join our effort and we go and reach like the RSHS department, which deal with this information, the Commodity Security Committee, we also reach them together. If we find that this is difficult, then we change our strategy. We reach the members of the parliament so that they can amplify the voices through the parliament, and the minister will respond to this, and then it will go down, then this data will be available. So all in all, what we have seen, we need to make a policy change. So having something, a policy documented is really hard to change. So that's why we're thinking of, as our next step, to work on having a guideline. So the permanent secretary, if he's going to issue the directive on family planning data to be available online, then that is a big win for us. So I think also other countries, they can also do the same thing, depend on your context. So you can work as a coalition, and hopefully you can achieve more. Thank you.
Maybe just an addition. In Malawi, in terms of the context of data, maybe similar, but not, we haven't reached the point of getting to the policy. But at least as you're working, when you engage, there's that transparency of information with the decision makers. We found that it becomes easier each time you're collecting the data for people to open up, even though it's not online, they'll actually give you the data. And then recently, we've engaged the Ministry of Health to say, okay, Ministry of Finance is saying the program-based budget is too large for the government, for them to put it on the line. Can you, as Minister of Health, break it down and put it online? They said, we never thought about that, but can we continue the conversation? So we're thinking that if we continue that conversation, they'll be able to get the information that we're looking and putting it online and in our advocacy. And to us, we look at that as a win that we can actually work with. Thank you.
Thank you so much, Wesley. Lenga, do you have anything to add to that?
Well, the scorecard, I think, was comprehensively talked about by Charity. And really, for best approaches, I was thinking in line with Nazil. Yeah, I think policy is what would work. In the Zambian context, really, we don't even have an act that supports access to information. And I think this is what has actually delayed us or has made us have so many challenges, because we cannot easily go into government premises and ask for this information. We do not have the act, and it has taken us quite some time for us to even get there. We're hopeful that the new government might work on that, and this will enable us to be able to get information. However, with the work that we have been doing, we are seeing strides, significant strides being made, because now the Ministry of Finance is able to share on their website disbursements that have been made in a month. So I'm guessing we're making progress. If this can be done also with the Ministry of Health, then it would be very easy for us to just go on the website and get the information we're looking for. Thank you.
So I know we have at least 2 more questions. Can I pass this?
Yes, please. Thank you for your nice presentation. I think my question is related with, can you share us your experience pertaining to your work towards with the parliamentarian? Because there is a standing committee within the parliamentarians who are responsible to oversight the Minister of Health and the Minister of Finance. So can you share us a bit your experience towards working with this parliamentarian?
Okay, thank you for the presentations. My question is directed to Uganda. You talked about the FP 2030 commitments, and you said they haven't been realized like 10, 11 months down the line. But I wanted to find out what you mean by realize. Is it the signing or the implementation? What do you mean by not being realized? Thank you. Because as Zimbabwe, we are also having a challenge we have come up with our commitments together with the government, but the signing and the launching, we are still sort of engaging with the government to commit to that. Thank you.
Yes, please go ahead.
So to share some best practices from Zambia, as regards collection of data to inform the scorecard. In Zambia, we came up with a costed implementation plan, and this document kind of was developed, with wide consultation from stakeholders in the family planning field. The costed implementation plan is a guide that guides implementation of family planning programming in Zambia. it contains a lot of things, and among them, it also contains information on how much the government has spent on family planning alone over, the previous, for example, 5 years. And moving forward, it costs the activities, including the commodities, demand creation, advocacy, and service delivery. And it indicates how much will be needed, and this is, the population is also put into consideration. So it indicates how much you're going to use in the next 5 years. So if you have a document like the costed implementation plan, I think the government feels maybe a little bit more relaxed to share information, because not only is it bringing out information about the government, it's also talking about what can be put forward in order for us to achieve our family planning goals. I just wanted to answer the colleague who asked about best practices. Thank you.
Do we have any more questions from this side?
question about.
Amos?
Thank you so much. I just want to add on what Lois was saying in terms of how maybe our colleagues from Zimbabwe can actually pursue their government to ensure that their commitments are signed and launched. So from Zambia also, what we've done is that we were able to use the amounts in the costed implementation plan and translated them into the commitment, because that is what has been agreed as by all stakeholders. So we use that as key to ensure that the signed commitment reflects the similar amount that is in the costed plan. That way it's easy to have the same information that goes around and ensure that it's able to be implemented. And in terms of the best approaches also, we were able to ensure that there's a lot of dialogue between the Ministries of Health and the Ministry of Finance. One of the things that we've learned is that now we have learned to speak the language that the Ministry of Finance wants to hear. So for instance, we are using the demographic dividend language to ensure that we actualize our costs in family planning and what they are going to see. So that is something that we are using. Thank you.
Great.
Excellent.
Do we have time for one more question? Or?
Can we hold on to the
Yeah,
questions
okay, we'll
so
hold
that
on one
our
second.
panel
So
can digest some of these questions, and then we'll get on a third round of questions.
Okay,
And
great.
we have some time, so we'll be able to get to you. Who would like to go first on this? Around the question of engaging legislators. Wezi, please.
Okay, thank you very much. In terms of the parliamentarians, our practice in Malawi has been that what they want is you break it down to what they can actually understand. So when you're presenting, you take the language of the technical language, break it down to what they can understand. And as you are actually engaging them, they are also able to say, okay, if you want us to pass this in Parliament, maybe present it in such and such a manner, and then you give us that write-up, we're going to actually take it all the way to the Parliament. So it's that engagement process for us, that's what has actually worked and moved the process forward. But I know, maybe Tanzania.
Thank you, Wezi. Experience in working with the members of the parliament. The members of the parliament are usually seeking for information to speak and question the ministers. So what we do is actually we are, as a coalition, and also when we reach the members of the parliament, we select first which committees, because in the legislative house there's different committees. There's a social and development committee. I think even it's related to other countries as well. And we have there are members of the parliament who are in the Association of the Population and Development. And I hope, I think one of them is here, is attending this SFP. Members of the parliament who are in the association, women, members of the parliament, because this issue also focus more to women. So what we do is actually we prepare them with the relevant materials, the fact sheet, the scorecard, We share with them. One of the things of the increase of the allocation is because of sharing with them the budget scorecard. Because when you see the gaps and when you see why this budget is constant allocated, so they get words to question in the question sessions, and also they seek response from the Ministry of Health. So this one, it activates the accountability. So you see, so this is one of the good experience, and engaging members of the parliament has been very effective, because out of it we are even having champions, members of the parliament, MPs, who are the champions on family planning in our country. Thank you.
Thank you, Nazir. There was a question specific to Uganda's context, and Charity, over to you.
Thanks, B. So the question, actually, I think I'll first make a clarification. I was referring to the FP 2030 commitments, and our commitments were launched. They were developed and they were launched in December of last year. So what I was saying was that the financing commitment, one of the 6 commitments, which is to allocate 50% of the reproductive health items budget to the procurement of FP commodities, the implementation had not started in this first year, and that's where our challenge was. However, we've gone ahead over the past few months in collaboration with various partners, like partners in population and development, PPDR, Mary Stops Uganda under the RISE initiative, Options Uganda, 3FHI, Action for Health Uganda. We've been able to engage with the Ministry of Health, National Medical Stores, and members of Parliament. And since then, we've managed to get the 25% allocation as guided by the director. So that's a step ahead of, as you know, in advocacy work.
Any other thing that anyone wants to add to this before we go back to the next round of questions? No? Okay, next round of questions. Over to you.
Yeah, thank you very much for the various insights provided. I'm really keen to know more about this idea of planning, costing, estimating, actually how much will be required, to inform the commitment, so that it is not ad hoc. Somebody in Ministry of Finance, Budget and National Planning, for instance, we want to have a sense of how much is adequate and what will this fund be used for. So I don't know if any of these case studies are in the federal system, because in the case of Nigeria, we have a federal system funding. Thank you.
Thank you very much for that question.
How are we doing on time?
We're still good with time.
We still-
We've got
okay.
about 5 more
So
minutes before we
right
wrap up.
behind you, and then you have 2 more questions over here.
Hi, thank you. Halima Sharif from Tanzania. Mine is not a question. Thank you for a very good presentation from the panelists. So mine is not a question. It just made me think far and hard in terms of our approach, or there are areas that we as advocates are not covering. I may be wrong, but I have the freedom to express my opinion.
Yes, no, this is the space.
I'm thinking advocates in this room and in this conference, we have moved so far to get parliamentarians to understand why family planning, to understand the impact of not investing in family planning, yeah? So we've come so far, and now they're seeking for that information to present it during parliamentary discussion. Hooray, we have scored. But then I'm thinking, are we targeting the right parliamentarians when it comes to disbursement and budget accountability? We have the TPAPD, as my colleague has said, which brings members of parliament from different committees. But should we, as my colleague has said, which brings members of parliament from different committees, data and evidence for decision making and holding others government accountable, maybe we're going to inch through the transparency piece. The policy guideline, good, but the implementation also needs a little bit So thinking out of the box. Thank you, moderator. I took a lot of time.
So thank you very much.
We have one more question here, Bea.
Hi, I just actually want to follow up with what you just said, because family planning is not just health. If you think about it as a development intervention, we may get more attention. I'm wondering, are there any tools out there that really show what is the cost of not investing in family planning in terms of development in general? Because in some ways, I feel like pulling family planning out of health, put it above health and in a development place where it gets more attention. So what is the return on investment in family planning in terms of education, health, environment, you name it? We know family planning has a major impact. So I'm wondering if anyone has any tools to be able to show that either return on investment, the benefits from a development point of view. It's a hard sell, family planning under health only, and then we just get a tiny bit of money.
Okay.
Apart from them showing the money, but at least do they also account for what was used at that stage? Yeah, and then just a general comment is about sharing the good lessons as advocates. I would encourage that from this forum, we should have something also that is working at the regional level. Yeah, thank you.
Thank you very much. So questions around the costed implementation plan as a tool in Nigeria's case, and I'll be happy to answer that question, but because this is more about our partners, I will make myself available once this is done and answer some of your questions for you. Around the engaging legislative with more strategic approach to ensuring that it not only percolates into more commitment, but actually gets weighed amongst those who do the decision-making around government financing and allocation. And the question about learning across from different countries and your experience with the disbursement, the allocation of the disbursement.
Sub-national level review meetings that have helped us know how much has been utilized for the program. Thank you. And I liked the question that was asked about tools on the investments, on family planning. I'm not so sure about the tool, but I would like to make mention that for Zambia, I stand here and I'm very happy to mention that the government of Zambia has realized family planning is actually a development agenda and not a health issue. And so this has also been highlighted in the 8th National Development Plan, which was recently launched, and this document speaks to how we plan to develop over a period of 5 years, and it speaks to the broader vision of the Vision 2030, where Zambia aspires to be a middle-income country by 2030. So for Zambia, I think we've made significant strides in realizing that family planning is actually a development agenda and not just a health issue. Thank you.
Maybe I'll start with the one that is on the tools as well. I'm not sure that there are tools where they actually asked us, okay, you're saying according to our funding needs level, they're too low. What is acceptable within the region? But unfortunately, we didn't have a benchmark at that particular moment. So we took it to PAI and say, okay, can we begin thinking to say maybe we should look at the aspect of benchmarking? Then how do you know that which country, in terms of the percentage, they're doing better? Because as of now, maybe from amongst ourselves, those of us who are getting, to say looking at what we have, this is possibly what we are looking for. But is that the best? Can we do better? Maybe those are the questions that in our area, I like it because it actually provokes the thought of doing more in terms of what we are doing. I think, I think those are the comments that I have. And in terms of the parliamentarians, you're quite right, the member who actually came. One of the things that we also discovered is when we were meeting the parliamentarian committee on the health,
what we do is we actually have to update them because they're the ones who are going to make the government to be accountable. the parliament. So we actually depend with them and sharing this information regularly. And another thing, we also introduce to them theories of demographic dividends. How is it important? Because as you know, demographic dividends, if you hear and if you don't know how to, if you don't know how it deeply, then you didn't see the essence of its application. So demographic dividend is one of the things that we have been sharing with them, different models. Each models that we are trying to make several meetings with them, sharing with them, so that they become much aware, more confident, even when they speak in the parliamentary house. And there's another question about the CIP. What was it about?
The costed implementation plan. I think the gentleman from Nigeria was asking how it could be done in their case and how it could be applied. And I said I would happy to answer that question for him. Yeah.
Okay, thank you. Because for CIP, for Tanzania, we're in CIP 3. And the other thing...
Planning. So various MDAs, the Ministry of Health, the Ministry of Education and Sports, the Ministry of Gender, Labor and Social Development are working together to ensure that all these indicators are achieved. And from national level, also at subnational level, various departments in the districts are ensuring that they work together, they allocate resources, and they deal with issues such as teenage pregnancy, which cuts across, and it affects all these sectors. So we also, we are trying as much as possible to come up with studies that can show the cost of inaction. The UNFPA has been very, the study on teenage pregnancies and how they increase during the COVID-19 pandemic. But now we're going into also value for money, because partners don't want to invest in anything, any interventions just to invest. They need to also see value for money. So we'll conduct studies on this and provide evidence for return on investments and costs to areas like education and health if the country invests in family planning. Thank you.
Thank you so much. We are strapped for time, but I think one thing I wanted to end on the note is that we started this conversation talking about using tools. Around, if you have questions for us, I'm going to be addressing one question, but if you have questions for any one of our panelists or myself, please feel free to reach out to us. We also have the QR code so you can scan. Take a look at the scorecard for those who are from Malawi, from Tanzania, from Uganda, and from Zambia, and you want to look at what your scorecard looks like. Please use this scorecard, please use the scans to find out. If you can go on our website at pai.org, if you want to find out what the scorecards look like for our different partners in the Francophone side of West Africa, we also have that information there. So please, please, please reach out to us if you have any questions. Thank you. Thank you all very much. Thank you. Thank you all very much.